So this is some research that was the end of my PhD, but this particular research was conducted just a couple of years ago, and I really want to give a shout out to Ashley Sharman because she's really been driving this research and also the dissemination of this resource. So we wanted to look at the acceptability of an evidence-based booklet for people diagnosed with HPV-Related Oropharyngeal Squamous cell carcinoma, and also speak to their caregivers as well. So the aim of this was to explore the suitability of the booklet. So this was originally developed in the UK, and we adapted it for the Australian and New Zealand context. So we wanted to test the readability, comprehensibility and acceptability, and as well explore the psychosocial response to the booklet. So just quickly, the methods: we recruited through social media and interviewed via Zoom. We had Julie McCrossan on our research team, so she did an amazing job at helping recruit people through social media. We showed participants the booklet online, and we did think aloud interviews with them. And the responses were analysed for each of the booklet sections and coded as kind of like whether they liked it, whether they didn't like it, and also we coded other responses thematically. So these were the kind of the main themes that came up. So we had emotional response to the booklet, information needs, health service factors, and the booklet response. So in terms of the emotional response, we did find that some people felt, with HPV being a sexually transmitted infection, they felt some shame and stigma, but they also felt a sense of relief, because really what the booklet was trying to do was normalise HPV. It is the most commonly sexually transmitted infection. But they also had concern for family. There is some information in there as well about information for their partners as well. This sense of an unlucky attitude. And also they felt that it had some patient support. So they found the booklet was really quite helpful, and we made some changes but for and against based on their recommendations. And they also talked about the role of healthcare professionals and the role of the vaccination as well. And I just want to give you a quick, so these are just some of the quotes that came out. So the unlucky attitude: I'm just unlucky, and I can deal with it if I'm unlucky rather than having something to blame. We also talked about the vaccination. So they were, somebody was happy that because they had grandchildren and their family were going to get vaccinated. I'm not going to whiz through these because I literally don't have any time. Okay, so all participants found that the booklet was useful. A large proportion wished that the resource had been available previously, and also some indicated that the information was new to them. The majority agreed that it would be best delivered by their specialist at the point of diagnosis, and that it would also be a really useful resource for family and friends, because we really found that some people didn't like talking about it, and that this booklet kind of gave them an avenue to be able to speak. Most found it helped reduce shame and stigma associated with the HPV as a sexually transmitted infection, and overall it was well received. And this is just a very quick example of how things have changed. So on the left-hand side was what it did look like, and it's been redeveloped. And there is a QR code if you want to look at the booklet, and I've also got some physical copies as well.